afternoon. It is 2:30. Welcome to CCDPH Schools and COVID-19 Weekly Update. My name is Kelly Jones. I am a senior health educator with Cook County Health Department, and I am your host for our weekly webinars. Let's get started. Our meeting objectives are to provide updates and support schools while navigating COVID-19, answer frequently asked questions you may have, and provide CCDPH contact information and resources. Few announcements for you. All of our webinars are recorded and they're uploaded to our website as well as our YouTube page. You may reference those at your leisure. We begin promptly at 2:30. Please keep your lines muted and our chat will be disabled during the presentation and turn back on for Q&A. Let me know when you're ready for me to turn that line back on for you guys. Here is our contact information over at CCDPH, our COVID-19 general email where you can ask webinar related questions and any general questions, our CCDPH communicable disease reporting email where you can report your line list, report communicable diseases, not just COVID, and any metrics questions, our Cook County website, Cook County Health Department website, our schools related page, and our vaccine related page. And if you would like some tools that you can print and put around your facility regarding COVID-19, we have some items that are downloadable on the following website. Please send all EpiPen requests to me, Kelly Jones, at kjones1 at cookcountyhhs.org. All requests must come from the medical professional, i.e. the school nurse, or the person has to be certified and trained in the administration of medication. There's a little bit of a process that has to be completed before you are certified to administer medication. And please type all your requests. Bulk PPE resources are available for schools, schools and different organizations who may request them. And there are different things as gloves and other items, and you can request them in a certain, I'm just so frazzled. There's no limit to no request items, but you may not receive everything that you have requested just based on availability. So check that website out if you would like to have some PPE items for your school. The following villages, we are trying to have some hyperlocal strategy and implore some resources. So we are trying to host events in these following villages that are listed. They have a little bit of the lower vaccine intake rate. So we're trying to help them by having some vaccine events and some educational events. If you would like to have us come to your village and you are part of the areas listed, not just the areas, but any of the areas listed, please contact us at the email address below and we can get that started for you. If you would like your school to be a vaccine site, you can request the vaccine event at the link below. And I know with the 5 to 11 being approved soon, that probably will be a request that we'll probably get a little bit more often. Speaking of area events, starting now, actually it started on the 12th and it ends tomorrow, Cook County Health Department will be vaccinating and providing some education at Sauk Village Shopping Center, 19 Sauk Trail in Sauk Village from 12 to 6. We are also co-sponsoring a mental health fair and vaccine fair with the Link Option Center. And that is next Saturday, the 23rd from 11 to 2 in South Holland. Here's a list of some other upcoming events that are happening around the community. And if you attended the vaccine event in Hazel Crest and you need that second shot, October 23rd, they are there for that second shot. And the last date for that farmers market in Harvey will be on Thursday, October 21st. Please stay tuned. There are more community events coming. And if you'd like a list of all the upcoming events that we have planned, you can find them on our website at the following address. I shared this last week, but I'm going to share it again. There is an upcoming webinar from the EPA on ventilation in schools. It's Thursday, October 21st. I will send that registration information with the slides if your school would like to attend and find out information on how to access your ventilation systems and update them if possible. If your school has an existing COVID-19 testing program, please fill out the following survey. We'd love to hear about it. And if you would like to request any of the rapid antigen by next tests, you may do so at the following website. I'm sure this is old news for people who's been with us from the beginning, but just still sharing. If you'd like to have shield testing at your school, you may contact IDPH at the email listed, dph.antigentesting@illinois.gov, and they can get that started for you. If you have an event coming up and you would like a health professional to attend in order to speak about COVID related issues, you may request it at the following link. And also, it'll ask you a little demographics about your event so that we can fit the best person with your event. And if you need a particular language, please make sure you enter that as well. And we can try to match you up with a professional speaker from our bureau. If you or someone you know needs a ride to their vaccine appointment, but they do not have a ride, they can call the following number for our destination vaccine program, and they will pick them up, take them to their appointment, wait for them to finish, and then drive them back to their shot, to their home, I'm sorry, from their shot. And as well, they can call the same number, the 833-308-1988 number. If they are homebound but would like the vaccine, they must be within Cook County jurisdiction, which excludes Skokie, Evanston, Oak Park, and Stickney, as they have their own local health departments. And they must be homebound, 65 years of older, have a disability, or use adaptive equipment such as a ventilator, crutches, walker, or wheelchair. Here's a list of other resources. And we thank you for your attendance. I'm going to toss it over to Lex. And Lex, just let me know when you'd like me to open up the chat. Thank you.
Will do. Thanks, Kelly. All right. So, not too much big news or huge updates this week, which is pretty nice, to be honest. So, we are going to go over like when you can expect vaccines, all the meetings, when they might be approved, when we get that ball rolling, usual updates for metrics, travel guidance, some repetition from last week because I know some people might have been off for the holiday. Sorry, allergies still. And then kind of what you can expect for the spring semester and maybe the next school year. And we just had a single submitted question, but of course you can always put something in the Q&A if you have questions. So as per usual, our highest priority in responding to you guys will be for outbreaks, and lowest priority is travel scenario or a what if scenario, or notifying us about travel that someone's traveled. And then honestly, the most important part of this slide is just the registration for the webinar and the YouTube link in case there's someone you need to share that with, other nurses in your community or administrators who would like to attend. So when this gets sent out, those links will be provided. I can try to copy and paste and put them in the chat as well. And just a reminder again, check our website for past webinars, for guidance, for vaccine signups, to request immunization records. We can show you how to do that, things like that. It's all there, easy access, click tabs, and you should get what you need. Always a good place to start when you're not sure if you need to contact us about something or not. And then we mentioned this last week, but for those who missed it, the outbreak definition has changed and it applies retroactively to cases that have occurred since the 1st of the month. So it is now multiple cases comprising of at least 10% of students, teachers, staff within a core group, or 3 cases in a core group. So it used to be 2, so we're just adding 1. And this is for people who have contact at school or in an extracurricular activity of some kind, but not outside of school, like in a youth group or on a play date or things like that. So if you look at the definition of core group, that's kind of what we're getting at. That's either a cohort, a classroom, if you're in BASP or you're teaching BASP, or a sport, all those things, those are core groups, people who are having contact specifically at a certain time. And just some things to consider before, just when you're suspecting that there might be an outbreak, that there's not one officially declared yet, ask about symptoms, get as many dates as possible of tests, of when symptoms started, possible exposure, and be sure to ask any of the cases or close contacts, if they're having contact, outside of the school extracurricular programming setting, because it's potentially not actually an outbreak at the school, but rather it was a travel soccer team or something like that. So obviously, we want to make sure we're tracing the right situation before we actually declare a school outbreak. All right, so some vaccine updates. Moderna booster has been voted by the FDA advisory panel to receive emergency use authorization. The FDA still has to give a final ruling, but for people who received Moderna, that booster dose is coming. You guys will be eligible. It's the same folks who are eligible for the Pfizer booster as well. And for Moderna, it's actually a half dose. It's, if you're planning on getting a booster and you have Pfizer or Moderna, the side effects have been similar to what you experienced for your second dose. Just if you need to plan around that, if it knocked you out for a weekend or something like that. And then today, the FDA panel is meeting to go over whether people who receive Johnson & Johnson can get a booster of Moderna or Pfizer. That will likely be approved. We have some promising data in that, but just so you know, that's a meeting happening today for other boosters. And then for children aged 5 to 11, for the Pfizer vaccine, the FDA panel is meeting at the very end of October, and then the ACIP is going to be meeting on November 2nd through 3rd, and then usually official approval happens shortly after that. So middle of November is what we're looking for. Should not have the same supply chain issues we had at the beginning of the pandemic and vaccination. So that's when you can expect it. Hopefully, you can put more expectations on people for the spring semester. We are pretty much in the same place we were last week in terms of metrics. We're at a little bit of a plateau, possibly decreasing ever so slightly, but there is a lag, so I can't be 100% sure that that's a true decrease yet. So kind of where we've been in the last month and a half or so. We are slightly down in our case rate, so I'll take that. And I added this statistic because it hasn't been up, but for context for everybody, about 55-ish% of our population in the CCDPH jurisdiction has been completely vaccinated. For a really infectious disease like we have now for COVID, we need, closer to 90 to 95% of people to be vaccinated. Obviously, we've got big chunks of the population that aren't eligible yet, but just so if you're hoping for vaccination related herd immunity, it's going to be a lot longer and possibly very difficult to achieve. Just wanted to give you the context of our general community. Number of active school outbreaks has slightly gone up, but we're kind of staying in the same place we have been. And when I was looking at the list of schools, pardon me, there's actually a lot of daycare outbreaks. So if you think, you've got childcare that's connected to your school or within your school district, or your child's daycare would be interested in attending webinars or things like that, feel free to give them the link as well. Something we'd like to address since their guidance is slightly different, but the same principles generally hold: masking, distancing, things like that. Travel guidance, the map has stayed the same this week. California's a go, Connecticut's a go, Puerto Rico, and that's about it. As always, if someone isn't vaccinated, they shouldn't be traveling to these states that have high daily case rates. For vaccinated travelers, they just need to be monitoring their health. For unvaccinated adults who, aren't students, they do need to get tested after they return and wait till they get those negative results, or they can just quarantine. And then for unvaccinated students, they can return to school immediately, but they should get tested after they return and always monitoring their symptoms for the full 14 days. International travel, there's a more rigorous process to that, and airlines aren't going to let you fly without going through that process. It is actually pretty easy to follow because, they've got a rigid set of rules. All right, for those who missed it last week, we are now accepting negative point of care or rapid PCR test results, in addition to the lab based RT PCR results we were accepting before. The science hasn't changed, but we recognize that asking for a really specific lab based test was putting a really big burden on the school community, on us, on families trying to figure out just what tests they even received. So we are accepting PCR results in general, and a lot of doctors' offices are doing those rapid point of care PCR tests. So it should be a lot easier for people to know where to get tested and to be able to submit those results. But we're still not accepting negative rapid antigen tests. So waiting on antigen tests for the community level of transmission to go down. Hopefully we'll get there eventually. And we're still not accepting alternative diagnosis due to existing conditions or a doctor's note for an alternative diagnosis. So as you can see, I've got a sinus infection that would keep me excluded unless I also had gotten a rapid PCR test, which I did. So if I was a student, I would have been excluded until that negative result came back. And then for shield testing, it is a lab-based PCR test. It's really got an incredible sensitivity. Actually, like it can detect people before they might even be infectious with just a small amount of viral shedding, which is really impressive. It won't be discounted with another test, like if you get a shield test at school one day and then later that day after you go home you go and get a lab-based PCR test. Once you're positive with shield, you're positive. I also put in the link for the FAQ for shield because there's a lot of questions and it's a very comprehensive FAQ. Look there first before you email shield with questions or ask us to talk to IDPH and the University of Illinois. And then I just wanted to explain, because this has been tripping people up and I know it's a little bit confusing. So test positivity is the number of positive test results you have divided by the number of tests that were performed over a given period of time. When you start a screening program, you're performing more tests in the hope of catching people who are pre-symptomatic and who are infected. So your numerator, the number of positive test results, will increase a little bit because you're catching those people who wouldn't normally seek out testing, but you're drastically increasing the number of tests that are performed. So you're really increasing the denominator, which is going to make your test positivity artificially lower than it might otherwise be. So the more tests you perform, the number of positives you're catching is, I mean, really, hopefully, that would be really scary if it was equal to the number of tests performed. Why you can't, if you have a screening program, you shouldn't be comparing your test positivity to the general community test positivity, because if you're a school that has screening, it's going to be artificially lower than the community test positivity because that's more people who are experiencing symptoms, or to schools where they're only testing symptomatic people. Their test positivity is going to be higher because they're not performing as many tests. They're not capturing those asymptomatic and pre-symptomatic people. That's not the goal of whatever kind of testing program they have. So you should only be making comparisons between schools or scenarios that have a really similar screening program to you. I just wanted to point that out. If you're a school that doesn't have a screening program, don't panic if you're manually calculating your test positivity and it's way higher than all these other schools. It's probably because they have screening programs in place and they're performing a lot more tests. So I just wanted to put that out there. And then, since there wasn't that much new guidance, I did want to give you guys a little bit to start thinking about for the next school year and for the next semester. So, as I mentioned, younger age groups will likely be able to receive a COVID vaccine by the next semester. Very exciting. Waiting for that full FDA approval for the Pfizer vaccine. That will just, add it to our official vaccine schedule. And then kind of go over some of the logistics about how, like, a pandemic emergency situation ends. So, the pandemic is declared like a legal emergency globally, in the state, in the country. And many of the rules that are dictating our lives at the moment are legally contingent on that declared emergency. So we're under a series of emergency orders, which would not otherwise be able to be put in place quickly or just due to other restrictions. So the circulation of COVID will probably still continue after the emergency is declared over. Um, but that's not going to happen until hospitalization rates are a lot lower, so we can make sure that our hospital systems aren't overwhelmed. That will happen when community transmission is low enough that we can trace every case, and that's a really effective way of containing it when we see it pop up. Um, we're gonna it will the pandemic will end when we stop seeing large surges of cases, and it may take on, and we don't know this yet because most of our experience with pandemics is with flu, but it's possible COVID will take on kind of a seasonality to it. So when we're all huddling inside for the winter up here, or in the south when it's really hot, it's actually pretty bad in the summer there because that's when people are staying inside, in August or something. So workplace vaccine or testing requirements will likely remain in place while emergency orders are in effect, and it may be altered once the pandemic has been declared over. Indoor masking in the school setting is not going away anytime soon. It will probably still be in place even after indoor masking is not required for the entire state. It seems like, as a state, we're trending pretty well. So it's possible that indoor mask mandate will be lifted. I mean, not in the next week, but like coming up ish. But schools will still have that in place after that's over. And it may be that masks become pretty regularly used, especially during the flu season. I just want to mention last year we didn't have any pediatric flu deaths, which is, I mean, obviously amazing. Masks work, and masks really impacted the last flu season. So it's possible that's going to be sticking around what becomes law after the emergency orders are over. And then we're really hoping to be able to use those point of care tests, the antigen tests, the Binax Now tests, come up hopefully before even the pandemic is declared over once we get into those very low transmission levels. Things that will be important, I mean, they're important now, they'll be important in the spring, and unfortunately, I have to say, the next school year will not be it's not going to be a complete return to normal. There are still going to be some things that are important. It will certainly be much more normal than it has been. But key things that are going to be really important going forward is good ventilation. If you have the budget, like now or this coming summer is the time to invest in better ventilation. Always, always, always good hand hygiene. That has been helpful, keeping levels of all diseases much lower. Making it easier to stay home when someone is sick. No one is a hero when they come into the office coughing. Making it like you don't have actually more work to do when you miss class as opposed to showing up dripping snot. I just wanted to give you guys a heads up that if you were thinking 2022, 2023 is going to be the year, we get all back to normal, it's going to be great. It will still be different. It will definitely be better, but I just wanted to let you know it will still be a little bit different depending on where we are. It will definitely be better than where we're at right now. All right, submitted questions. Kelly, feel free to open up the chat while I go through this one. Well, we got two questions, but they were basically asking the same thing. When does CCDPH recommend outbreak testing versus quarantining in classroom? So basically excluding that classroom when there's been an outbreak in that classroom. We were advised to shut down a classroom, but now have families asking why outbreak testing isn't happening. So these two different strategies are not mutually exclusive. They can be done one at a time or simultaneously. They're both good options. So classroom closure is a good option if physical distancing is going to be really hard to maintain in that classroom. So either there's not enough space, or the students are really young and they're not good at maintaining that distancing for themselves. if the situation is getting a little out of hand and cases keep popping up, and the school and the health department need to like regroup to better understand the outbreak situation, they might ask for a short classroom closure. If the cases in the classroom were sitting further away from each other and had no other contact, but somehow someone from the other side of the room managed to be infected, then we'd be concerned that there was maybe like a super spreading incident or really poor ventilation situation. So we need to examine that classroom a little bit further. Or there's not already parental consent for outbreak testing. Outbreak testing should happen begin happening within 3 days of the outbreak declaration. And that's not always enough time to gather parental consent. So if you haven't already, it's a good idea just to have that consent on the books. But that is also one of the reasons why classroom closure may be the better strategy if it's going to take too long to start the outbreak testing. Obviously, outbreak testing is a great strategy to keep kids in school, and it should be implemented to the greatest extent possible, but it's just difficult to get the ball rolling if you don't have the logistics in place yet. So, which of these strategies will be employed, if they're both going to be employed, just depends on the situation, and it's a case-by-case situation. So it's not a black and white answer, but I do hope that answers your question. All right. And then I just wanted to go through and remind you guys, we have these reference slides. Remember that cases isolate, but close contacts quarantine. There is a difference in that terminology, and that difference is important. Symptomatic household member documentation reference slide, guidance on how to choose what quarantine option is correct for somebody. And then just as a reminder, test to stay is only allowed if a student is enrolled in weekly screening. So just a reminder there. I'm going to stop sharing and take a look at the chat. Okay, this is a really good question. What is the difference? Oops, sorry, popped off my screen for a second. What is the difference between antigen testing and rapid testing? So rapid testing just means a point of care test where you're going to get those test results pretty soon after it's taken, like within 15 minutes, something like that. And rapid tests can be testing different things. So an antigen test is a specific type of rapid test, but you can also have a rapid PCR test that gets returned, and they're just measuring genetic material or your antigen levels. So they're just measuring different things, and measuring genetic material is generally a little bit more accurate. So that's why we're accepting rapid PCR tests, but not rapid antigen tests yet, like the Binax Now test. When we have a positive sibling with symptoms quarantined for 10 days, does the negative asymptomatic sibling quarantine a total of 14 days from when the sibling started symptoms, or do we add an additional 14 days to the negative asymptomatic sibling after the 10 days are completed? So it's the second option. If it's not possible for those siblings to live apart for the first case's entire isolation period, then the asymptomatic sibling who's been feeling fine, their quarantine starts when their sibling's isolation ends. So that is a long time to stay out of school, but it's the last possible day that they could be exposed. So it's that second option. If a positive case has had no contact, living in a separate room with an unvaccinated household member, does the household member need to quarantine? If you can really guarantee that there's no contact. So living in a separate room isn't good enough. You have to make sure they're not sharing a bathroom, they're not eating in the same place, things like that. Like if you got like a pretty furnished basement or something and you want to have the case be living in the basement where there's a bathroom and a sink or whatever, then that would be fine. If there really is truly no contact between that case and the household member, then they do not have to quarantine because they haven't had contact with this person, theoretically. In practice, that's a lot harder to guarantee, but technically, if they haven't had contact, no quarantine needs to happen. Oh, it looked like I didn't see. Pollock already answered the molecular testing versus rapid tests. Thank you, Pollock. On slide number 12, it states that CCDPH is no longer accepting alternative diagnosis due to existing conditions. Aren't allergies and migraines pre-existing conditions? Letters for pre-existing conditions are still being accepted, correct? Letters for pre-existing conditions are not being accepted anymore, and that is per IDPH. I'm just gonna pop in the chat the updated decision tree link because that was broken for a little bit, the FAQs, and the general school guidance because I don't remember which one of those it's actually in, but in one or all of them, it states that we're no longer accepting alternative diagnosis.
Sorry, Lex, I just wanted to add in, it's for new symptom onset. So I think if a note, at least we've been accepting when a person already has a note for, let's say, allergies, but then if there's a new symptom onset, then we would definitely recommend testing.
Right. So jumping off of what Pollock said, we're assuming an individual with a pre-existing condition, they know what their migraines feel like. Maybe they know what the aura feels like or whatever. So if they have a headache that is somehow more intense or in a different location, that's something we would be concerned about. Or someone who has allergies and all of a sudden they have a cough and they've never had a cough with allergies before, then that's when you should seek testing or go to the nurse's office. If it's your like usual day-to-day situation, we're assuming you're fine enough to carry on. You wouldn't need to go to the nurses to be excluded. If you feel sick enough to stay home, then you should get tested. So yeah, the key there is for new things. Outbreak school closure. What is the definition of an outbreak in P through 12 schools? It is now 3 cases that is new from IDPH. Basically, the number that will be included in the outbreak definition will go up as community transmission goes down. But when community transmission is high, that number will get lower so that it's easier to investigate or find an outbreak. Is there a set percentage of a class that must participate in outbreak screening to avoid a whole class quarantine? I do not think, and Pollock, you can correct me if I'm wrong, but I tried to find this in guidance today, and I couldn't find anything that said there's a set percentage. It just said it was, between the school and the local health department to decide when it's proper to.
It did mention 10% on our web portal, but I told Justin, I wrote there that I can double check and I can get back. I do want to mention, though, we are receiving specific questions to specific situations. So I highly recommend that you email us so we can at least give a better, more detailed answer by uh, making sure we research and not quickly send you the answers, which may not be complete here. And it doesn't take time away from other general questions.
Let's see. For tests to stay, we are only taking rapids. You can use other tests for tests to stay, but rapids is, the best option, so you can get those results back on the specific days that you need to be tested. If a student or staff member receives a positive Binax test and then receives a negative PCR, which one takes precedent? A positive result will always take precedent. Someone is generally infectious, for a certain period of time, but also viral shedding changes depending on what symptoms you're having, how early you are in. So sometimes, even though you're technically infectious, that test just caught it at like a bad time. So when you test positive, that was being caught at a good time. That positive will take precedence. The health department. Oh, that seems like one of those specific scenarios that we'll address outside of this. What do we do when students go to the doctor with COVID symptoms and the doctor tells parents they do not need a COVID test and clear them to come back to school? That is a good question. I believe IDPH has communicated with providers that if there's COVID-like symptoms, they should do a test. And now we've also, we're hitting flu season. It's the middle of October. There's also tests that will test for flu and COVID, or they'll test for multiple respiratory symptoms. So hopefully doctors know that if this is a return to class situation, they need to get a COVID test, or if whatever happened at the doctor's office didn't get a PCR test, there are lots of different sites and free testing sites too where you can get a PCR test.
I do want to mention that we have our medical director, Dr. Jackie Corpix, who has been communicating with some of the pediatricians one-on-one to let them know that, right now, given our metrics, we are accepting rapid PCRs and lab-based PCR, but and hopefully that should change. This is temporary until the transmission levels go down.
All right. Where were we? If a student is symptomatic and has a negative rapid test on day 1, so the day their symptoms started, but the lab lost the sample or a situation like that, and the student tests positive later and is now positive, is day 0 from symptom onset or from the positive test date? That's a great question. It's from symptom onset here. All right. To clarify, pre-existing condition letters are acceptable, including allergies and migraines. They're not acceptable to excuse somebody from a new symptom that they're having. So, if I apologize, my dog is barking at the lawn care folks. When you've got someone who's got allergies or migraines and they develop something that is unusual for them, that pre-existing condition letter isn't going to clear them to return and go back to school. We're assuming if it's part of their day-to-day life, they're taking allergy medications or whatever, they won't need to be excluded from school because they won't be going to the nurse's office because it's just what they've been dealing with. So they don't exclude new symptoms. It just means that, like, if you've got a cough from allergies, you don't need to go home. You always have a cough from allergies. So I guess the answer is both yes and no, but I hope that makes a little bit of sense. Like, if they go home, that letter can't be used as documentation. If it's just their day-to-day life and they're attending school, you don't need documentation for them to return to school because they're still in school. Let's see. A positive is a positive. What if there's a positive home test but a negative PCR that follows? Pollock, you're gonna have to help me with this one. We're accepting positive home tests as a positive is a positive, correct?
Yes, and we recommend that contact tracing be started immediately. And then we recommend that the person who is a positive via home test get a medical evaluation and get a lab-based PCR. Just because I don't know at what situation a person be positive for home test and then right away goes to the doctor and tests negative for PCR. That may happen with the whole virus. As Lex mentioned, it may be picked up intermittently by the test. So medical evaluation at this point is we highly recommend.
And if you're worried about, like, knowing what kinds of tests are out there and when it's appropriate to accept what, that link that Michelle popped in the chat is a good guidance for, like, what tests are what and how sensitive they may be and things like that. Um, excuse me. I think we've answered everything general in the chat. So I will throw it back to you, Kelly. And if anything else comes in, we'll answer it.
Sure. Thank you, guys. This meeting went by really quickly. Thank you all for your time. There is another question that just came in the chat. I believe it says, when will the pediatric vaccine be out?
For 5 to 11, we're anticipating like mid-November. They're meeting to talk about it at the end of October and beginning of November, and usually those approvals are short to follow.
Thank you for that. Well, I hope if there's no other questions, I hope everyone enjoys their weekend. It's a little chilly outside right now, so it makes me sleepy, but enjoy your weekend and let's feel better. And I will see you all next Friday. Thank you for taking the time out of your day to spend with us and email any further questions, and we will try to help you out as best we can. Have a great weekend. Thank you all.